As if your life wasn't interesting enough, beginning in January 2013, the American Board of Internal Medicine will shift to what they're calling a Continual Assessment and Improvement Certification model. This shift will affect all MDs, including grandfathers. Now, how do we plan for something like this? And you probably will learn that planning is definitely one of the goals here. I'm with Don Abbott from Brown University and Rhode Island Hospital, and you had a really nice presentation on the importance of lifelong learning and staying abreast of the literature. With as difficult a job as that is today, what did you talk about? What are some of the tips you have?
Thank you for inviting me to talk today. I think there's been a shift in the paradox of physicians continuing education from one in which a traditional method was to separate education from clinical practice, and the new model is to incorporate that where education occurs day to day in the workplace, and it is more patient-centered and it is more continual and lifelong. And so my job today in talking in the topic was really to introduce that to people and to show what the benefits would be and what the importance and how it will prepare you for this new agenda of the ABIM, but also help us take better care of the patients.
What kind of planning is necessary? Because instead of every 10 years having this come up on your radar, maybe it should come up a little more frequently?
The new plan is that you would be assessed every 2 years. There'd be a requirement for some type of continuing education, which already exists for most physicians in terms of their hospital privilege requirement. Most physicians are required to demonstrate a certain number of continuing education efforts every few years and show that to the hospital. But this is just going to be at the level of board certification. So it's an added thing, but it's not the only thing that's important. The purpose of my talk was really to focus on what lifelong learning encompasses and what the resources are that are available for physicians. As I said, the lifelong learning paradox is that all physicians want to be up to date and competent, but at the same time they feel it's really a burden. And so what was originally put in place to continue education, to reduce burden on physicians, to help with professional identity, it's really become more of a hindrance, and some people feel like it's just something else we have to check off a list, right. Something that has to be done in a very inflexible structure. So the point of the Lifelong Learning Initiative is to really show physicians multiple ways which they can accomplish lifelong learning goals, either through using society resources or workplace or point-of-care resources that are available to them.
A recent study was showing that something like 48% of all doctors show at least one sign of burnout. This is just one more thing that could light the fire. How do we add this into a schedule that is so already busy?
It's true, and that's why I said some people feel it's a burden. But if we think about it on the level of more patient-centeredness and patient care, and we identify gaps in our own knowledge so that we're driving our own continuing education, we can see the direct benefits for our patients. So it's not just that you've learned a new fact and you have to retain it. Right. It's just that you've identified new knowledge has come in to practice. We have to acknowledge that. We have to find a way to get that new knowledge to physicians and have physicians change practice and have it be a continual feedback. So lifelong learning is more of a continual assessment and feedback rather than a retention of new knowledge. So I think that's really important in this era of knowledge explosion. Last estimate I read, there are up to 10,000 new publications a week, more than any physician could read in their lifetime. So we have to filter that down to something that is obtainable for an individual physician in different methods. Yeah.
And there's also a lifelong learning division at the American College of Cardiology. Mm-hmm. And I think I've written about it, and if you want to go online and find out more about it, it's really a good place to organize your own CME and all of this. What do you want to call it that's coming down the pike as of January?
Personal educational portfolio. I actually participate in that through the ACC, and if you log in with your personal code, it can keep track of all of your educational activities. It can identify gaps in your knowledge. You can take pre-tests. You can sign up for different CME, and it will keep track for you on the website. Even educational activities like reviewing for the JACC journals. There's CME credits for that, so there's a lot of different ways to get your CME.
Yeah,
and
that-
keep track of it all in one place.
And if you haven't been there recently, that was redesigned and just launched in October or September, I think, of this year. So ACCCardiosource.org would be the place to go to. And for Cardiosource World News, I'm Executive Editor Rick McGuire.